Diabetes is a very common thing around the world. Around 1 in 4 Canadians have diabetes, whether it's type 1 or type 2. It is caused due to a certain organ in the body that isn't able to regulate a certain protein that is produced. This protein is called insulin. However, insulin hasn't always been known to regulate blood sugars, nor did people know much about diabetes, except for the fact that most people did not live past their 30s with this disease. The first discovery of insulin in 1886 was found during an experiment that was conducted on a live dog by Oskar Minwalski and Joseph von Mering. They took out a pancreas of a living dog and watched what would happen to it. A few days later, the dog would develop polyuria, and when they tested the urine sample, they realized that the dog had developed diabetes. So they conducted three more experiments on three more dogs and witnessed the same results every single time, thus showing that something in the pancreas would control the levels of blood sugar. Nevertheless, the study would not be continued until a certain doctor would continue the work of his fellow doctors. Frederick Grant Banting was born on November 14th, 1891 in Alliston, Ontario, Canada. He was the youngest of five children and was the child of William Thompson Banting and Margaret Grant. He would be educated at the public high schools in Alliston, but would further his education in the University of Toronto to study divinity and become a pastor, but he soon transferred into the study of medicine. Once he got his license in 1916, he would join the medical corps in the First World War and would be drafted into France. He would serve the duration of the war and return in 1919 to continue his education in medicine further. He would become a resident surgeon at the Hospital for Sick Children in Toronto. From 1920 until 1921, he did a part-time teaching in orthopedics at the University of Western Ontario in London and was also a lecturer in pharmacology at the University of Toronto. Banting had become deeply interested in diabetes during his time as a young doctor. He started learning about the protein insulin from a fellow doctor's study and wanted to continue the work. He and another doctor by the name of Charles Best conducted experiments aiming to find a way to replenish the insulin supplies in a diabetic patient. Attempts to supply the missing insulin by feeding patients with fresh pancreas or extracts of it had failed. Therefore, the problem now was how to extract the insulin without it destroying itself when extracting it. He and Best successfully figured out a way to harness the insulin and were able to put it into vials. Banting would find relief for millions of diabetic patients around the world, but as he said, insulin is not a cure, but a treatment. He would be giving a patent for the insulin, allowing him to profit off his discovery. However, being the humble man and generous man he sold the patent for $1 to the University of Toronto, saying, "Insulin does not belong to me, it belongs to the world." Banting would continue to serve as a doctor up until his premature death in 1941, cementing himself as an outstanding doctor and an amazing Canadian figure.